Hello everyone. Welcome to this concise guide on managing respiratory problem symptoms in a community pharmacy setting. Let us begin with cough. Cough is a protective reflex that helps clear the airways of secretions, irritants, and foreign particles. However, when persistent or severe, it may indicate an underlying condition. There are several common causes of cough. Viral infections are the most frequent cause and include conditions such as the common cold, influenza, and croup. Bacterial infections are another important cause and include tuberculosis and pneumonia. Gastroesophageal reflux disease, or GERD, can also lead to cough when gastric acid refluxes into the esophagus and irritates the throat and airways. Cardiac causes such as congestive heart failure must also be considered. Chronic respiratory conditions including chronic bronchitis and asthma are common contributors. Finally, certain medications can induce cough, most notably ACE inhibitors, but also NSAIDs and beta blockers. From a pharmacist's perspective, it is important to ask targeted questions to determine whether any of these factors may be responsible for the patient's cough. Now, let us look at some specific conditions associated with cough. Asthma is characterized by a cough, often worse at night, wheezing, shortness of breath, and chest tightness. Genetic predisposition is a common risk factor for this condition. Acute bronchitis is an inflammation of the bronchi, typically caused by a viral or bacterial infection. Symptoms include a cough with mucus, wheezing, shortness of breath, chest discomfort, slight fever, and fatigue. It can last for several weeks. Pneumonia is an infection that inflames the air sacs in one or both lungs, caused by viral, bacterial, or fungal infection. Symptoms include a cough with colored mucus or blood, fever, chills, and difficulty breathing. Like acute bronchitis, it can also last for several weeks. Croup is a viral infection, usually occurring in infants and young children. It is characterized by a distinctive, barking cough, and difficulty and noise while breathing. Tuberculosis, or TB, is caused by Mycobacterium tuberculosis bacteria. Symptoms include a bloody cough, fever, and night sweats. Coughs can be dry or productive, caused by infections, allergies, acid reflux, or underlying conditions like asthma or chronic bronchitis. It is important to note, however, that some patients with asthma may experience a dry cough rather than a productive one. Diagnosis involves sputum analysis. In general, viral infections are managed with over-the-counter medications aimed at relieving symptoms, whereas bacterial infections require referral to a physician for appropriate antibiotic therapy. Sputum color can indicate the cause of an infection. Green, yellow, or rust-colored sputum suggests a bacterial infection. Slightly yellow or mucopurulent sputum indicates a viral infection. Pink or red is a sign of TB or pneumonia. Non-colored sputum, mucoid, may be seen in asthma, heart failure, or chronic bronchitis. Infections are usually accompanied by systemic symptoms such as fever. Let's now look at the management strategies for a dry cough. Cough suppressants, or antitussives, include dextromethorphan, DM, which acts on the CNS, and first-generation antihistamines. Dextromethorphan is the most widely used antitussive. However, it has abuse potential at high doses due to its action on opioid receptors. It should not be used in children under 6 years of age, is contraindicated in asthma, and is best avoided during the third trimester of pregnancy. First-generation antihistamines like diphenhydramine and chlorpheniramine can also act as antitussives in patients over 2 years of age. Pharmacists should counsel patients about sedation and advise against driving while using these agents. They are contraindicated in benign prostatic hyperplasia and closed-angle glaucoma. Many experts recommend avoiding routine use of antitussives, as coughing is a natural mechanism for clearing the airways. Next, we will review the management of a productive cough. Expectorants, such as guaifenesin and ammonium chloride, loosen mucus for easier coughing. They are generally safe in pregnancy and breastfeeding. Mucolytics, like ambroxol and bromhexine, break down mucus structure. Both expectorants and mucolytics are not recommended for children under 2 years unless advised by a medical professional. The dosage of cough medications depends on the specific product, as many formulations contain multiple active ingredients. For children under 6 years of age, natural or herbal remedies are generally preferred. Refer a patient to a doctor if they have colored sputum, chest pain, suspected asthma, TB, or croup symptoms, failed cough medication, a suspected adverse drug reaction, or a cough lasting more than 2 weeks. Cold and flu are caused by viral infections and are often confused due to overlapping symptoms. Common symptoms include runny nose, sneezing, cough, nasal congestion, and sore throat. Flu is distinct due to muscle aches, high temperature, fatigue, and loss of appetite. Cold symptoms can include headache and earache. Flu symptoms have a rapid onset, usually involve a dry cough, and cause severe fatigue. The common cold has a gradual onset, typically a productive cough, and is less severe. Both conditions can be complicated by acute bronchitis or pneumonia. Allergic rhinitis is an inflammatory response to allergens such as pollens, dust, or fungal spores. Similar to the common cold, it presents with a runny nose, congestion, sneezing, and a mild cough. Unique features include intense nasal and eye itching, and symptoms last as long as the allergen exposure, unlike a cold. Now, let's explore the management for allergic rhinitis. First generation, or sedative, antihistamines like chlorpheniramine are effective for rhinorrhea, sneezing, and cough. They are less effective for congestion unless used with a topical antihistamine like azolastine. Age-appropriate dosing must be followed carefully. Second generation, or non-sedative, antihistamines such as cetirizine and loratadine are effective for rhinorrhea and sneezing but not for cough or congestion. Dosage for both depends on the child's age and weight. Sympathomimetics, or decongestants, are used for nasal congestion and not recommended for children under 6. Oral decongestants such as pseudoephedrine and phenylephrine should not be taken near bedtime due to stimulation and are contraindicated in patients with hypertension, heart disease, diabetes, or those taking monoamine oxidase inhibitors or antidepressants. Topical nasal decongestants, such as xylometazoline and oxymetazoline, should not be used for more than 5 days to avoid rebound congestion. Analgesic and antipyretic agents such as paracetamol and ibuprofen are used to manage headache, earache, muscle pain, and fever. If earache does not resolve with analgesics, referral is required for possible antibiotic therapy. Cough medications may be used as discussed earlier. Levetiracetam eye drops can relieve eye symptoms in allergic rhinitis and are suitable for patients over 12 years of age. Sodium chromoglycate nasal spray may be used for prevention and is safe for all patient groups. Combination products containing paracetamol, chlorpheniramine, and pseudoephedrine are commonly available for cold and flu symptom relief. Now, let us briefly discuss sore throat. Viral infections account for the majority of sore throat cases, while bacterial causes, most commonly Streptococcus pyogenes, are less frequent. Differentiation based solely on symptoms is difficult. However, features such as tonsillar exudates, swollen anterior cervical lymph nodes, high-grade fever, and absence of cough increase the likelihood of bacterial infection. Hoarseness results from inflammation of the vocal cords, or laryngitis, which is usually viral and self-limiting. Antibiotics are not indicated. Management is symptomatic and includes voice rest. Hoarseness typically resolves within a few days and does not require referral unless persistent. Some medications, such as inhaled corticosteroids, may also cause hoarseness. Dysphagia, or difficulty swallowing, commonly accompanies severe sore throat and does not require referral unless it occurs in the absence of throat pain. Finally, glandular fever is a viral infection most commonly affecting individuals aged 14 to 21 years. It presents with severe sore throat following a period of malaise, inflamed throat with creamy exudates, and enlarged cervical lymph nodes. Management is symptomatic. In general, management of throat conditions relies on oral analgesics such as paracetamol and ibuprofen. Antibiotics offer minimal benefit in most cases, reducing symptom duration by only about 1 day, and are therefore not routinely recommended. This marks the end of our video. We hope this information is helpful for managing respiratory symptoms.